was originally called a hypotension technique. But basically it's used for any type of condition in which there is low functioning in the child or the adult. Any type of hypo condition like hypothyroid, really chronic fatigue stuff, irritability, low immune system function, anything in that particular vein, this type of technique is very effective for. And it's simplified. It's very similar to what you did for the C-section technique because, again, the mechanics behind it is to move fluid through the third and fourth ventricle and to basically increase CSF flow throughout the system. And what you're going to do is you take your thenars and you compress the occiput exactly as we did when we did the C-section technique. The big difference here is just going to press and release and press and release once per second for about 10 to 20 seconds. And once you feel the occiput soften and relax a little bit, then you know you've started to move CSF through the third and fourth ventricle. So again, any type of lower functioning, type of fatigue stuff, chronic immune system depletion, anything like that after you've done your other adjusting protocols, this helps to stimulate CSF throughout the system. And then the hypertension technique, the in between that obviously is for high functional activities, things like ADHD. This works really great to help calm down, insomnia, any type of hyperactivity syndrome. And what you're going to do is you make a contact along the lumboidal suture. So you rest the occiput just as we did. Remember we did the occiput pump and spread thing where we held onto the suture? Well, we do the same thing here, except this time you have the patient breathe in, and as they breathe in, you hold the contact like you're pressing the skull, and you just hold it there. And you try and hold during inhalation for about 10, usually in kids, 20 seconds for adults. Exhalation, you let it relax. Have them do another respiration, and then the next inhalation you hold. Again, 10, 20 seconds, relax, so you do it 3 times. And what you want to do is try and balance the CSF. But again, the important part of this is that during inhalation, you maintain the steady pressure into that suture, and then you let it relax, and you do it 3 times. A little bit of caution here. Number 1, if you're done with this technique, when you get the patient up, go slow, because this can drop their blood pressure about 10 points. If they're on blood pressure meds, make sure that they check their blood pressure, check with their doctor. I had one woman recently who went to their doctor to get checked for her regular checkup, and I started doing this technique with her as well as some other stuff, and they wouldn't let her out of the office. The nurse practitioner came in twice, and the doctor came in and goes, I don't know what you're doing, but you can't leave your blood pressure 90/65. And she had been on blood pressure meds for 15 years, so obviously they readjust. Matter of fact, she's off the blood pressure meds now after 15 years. So just be careful with this. Don't get them right up off the table. If you have a high-low and you're getting them up, just make sure you get them up slowly, because like I said, this can drop blood pressure up to 10 points almost immediately sometimes, so you want to just go slow with it. And epilepsy technique. This is a 2-part technique. Now the reason this works so well is one of the things that happens with epilepsy is that there's a focal spot in the brain that keeps firing off. And that's basically what the epileptic seizures occur. So cerebrospinal fluid, as we talked about earlier, is one of those things that calms down the central nervous system by working as a cooling agent and also exchanges nutrients and also removes waste. So when you start to balance out the cerebrospinal fluid, especially through the sagittal suture, which mediates the flow of cerebrospinal fluid, it helps significantly with different forms of epilepsy. I've had it as extremely as getting kids off of all medication to reducing the number of seizures. The levels of extreme changes vary significantly. I've had one kid who came to me that the parent wasn't even able to comb her hair. Her head was so sensitive after applying the technique once. They were so elated that we were able to, the first time in a year, comb the kid's hair because it didn't hurt her head. I had a kid who was 9 years old that had been on seizure medication. His dad was an MD for years. Couldn't go out and play in the summers because once it hit 80 degrees, he couldn't even function. He'd get completely lethargic. After 3 months of adjustments and doing this, he hasn't been on any medication. He's 25 years old now. He's never gone back on it. So there's a lot of changes that occur through this technique. Again, for any type of seizure activity, whether it be petite mal or actually what they call tonic-clonic now, or grand mal, any of those types of seizures, like I said, this will help usually mitigate some of the symptomatology around it. Again, same deal, if you're doing this technique and the patient is on certain seizure medication, you might want to let the doctor or the patient know that they need to readjust that seizure medication. Because it's very common that when kids have seizures, they'll keep changing the medication because the body starts to get used to it, and then the seizures start, and they keep dosing the kid higher and higher, and eventually what they try and do is dose them high enough that the seizure activity stops, because a lot of the brain activity stops, and they become very lethargic, and they kind of, so when you start to do this, and I've done this numerous times, I'll tell the patient, look, I'm doing some work, you might want to check with your doctor to change the seizure medication, and almost invariably they're able to start to lower it, and also the spikes that cause the seizures can decrease. A lot of kids who have epilepsy, and when they go out in the sun, they see reflections of the pool that trigger a seizure. A lot of that stuff starts to calm down. So it basically makes their life a lot more tolerable. So 2 ways to do it. First part of the epilepsy technique is you're going to contact. Brush your thumbs over the top of the skull. Do not touch the top of the skull. And you contact the parietal at the suture between the parietal and temporal lobes. On inhalation, you pull the parietal superior towards you. And all of it. On exhalation, you hold the parietal superior, and then at the end of exhalation, just move them anterior. So inhalation, exhalation, and at the end, you move them anterior. Inhalation, exhalation, at the end, you move them anterior. The whole idea of the first part of the technique is to free the parietal along the sagittal suture. Once that frees up, then you move onto the sagittal suture. And what you want to do is palpate the sagittal suture from the bregma to the lambda. And as you palpate the suture, you look at the swelling, you look at the tenderness, you're looking for that, or depressions in the suture. Depending on which you find will depend on the technique you use. So if there's swelling and depression on the suture, what you have to do is separate it. If there are depressions or the suture is too wide, then you have to close it off. So again, you can use part of the visual analysis, but most of the time if you palpate, and what I do is I divide it into 10 points. And as I palpate it, I ask, okay, tell me which one of these points is the most sore. There may be one, there may be 2 of them, there may be 3 of them, sometimes there are more. Whichever one of those points are more tender, if the joint is compressed, what you do is you take your thumb, you hit your fingers, contact the parietal, you take your thumb on either side of those points, and on inhalation you spread, and exhalation you hold, inhalation you spread, exhalation you hold, and you maintain that until you feel the suture open up a little bit. If you palpate the point, you should be able to 60% less tender. On the other hand, if it's the spread part, then you should do the opposite. On inhalation you do nothing, exhalation you compress, inhalation you do nothing, exhalation you compress. And you want to do this until each one of these points are balanced. Like I said, maybe 1, maybe 2, sometimes it's 5. But again, you do that. The epilepsy technique you can apply several times over given visits. Again, if the parietal is moving correctly and the sagittal suture is no longer tender, then you don't do the technique. If the patient comes in, so if I'm treating a kid or an adult who have epilepsy, when I'm done with my adjustment, I'll just check the parietals and I'll check the sagittal. If the parietals are moving okay, I'll go right to the second part of the technique. So again, you just check it during the period of time when they, you're treating them. Just keep checking that technique. As the indicators fall away, just stop doing the technique as they start to fall away. And the last one that we're going to do is called the cranial bowl lift. And the cranial bowl lift is basically a reset of the cranial system. It's a very good technique for relaxation. Again, kids with ADHD, ADD, any really hyperactivity syndrome, this is a great technique to do with that. And what you're going to do is you place your fingers on the sphenoid wings, your middle finger on the temporal, ring finger on the parietal, get onto the occiput if you can, and straddle the sagittal suture. On inhalation, you take the entire cranium, separate at the sagittal suture, and lift the entire cranium towards you on inhalation. Hold it up there. On exhalation, you gently just start to rock it and bring it back down. Inhalation, you bring it up. Exhalation, you rock it and bring it back down. You do this until all of your fingertips feel like they're moving equally. You feel equal pulses under there. It's a very great calmative technique. This is the one I was talking about the other day. I said, when patients come in sometimes, oh, can you do that thing you do in my head before I leave? This is the one. It just balances out the system. Again, in symptoms of hyperactivity, or even things like hyperthyroidism, any of those hyperactivity things, this is a great technique to just reset the system, let it relax. It basically helps to balance, because a lot of these people are sympathetic dominant. What it does is it helps balance the parasympathetic nervous system through the cranial vault, and as it balances that part of the parasympathetic nervous system, it can actually start to work like it's supposed to, which means it can shut down the sympathetic stimulus, and it balances it. Again, one of the things that makes cranial work so powerful is that you're dealing directly with the parasympathetic nervous system. in chiropractic, when we're dealing with the spine, except for the sacrum, of course, we're always dealing with the sympathetic nervous system. We're always trying to change the input there. And the parasympathetic is in the sacrum and the cranium. So when you start to balance that, you make changes in the entire autonomic nervous system by balancing and putting parasympathetic input. That's what makes it so much more powerful when you add this on, because now you can actually balance both sides of the autonomic nervous
Do
system.
you ever do this with somebody before adjusting their spine, just to relax?
If I ever,
Or, I mean,
maybe, I mean, I can't think every time, but I'm not gonna say no, never. I've actually, well, no, it's not true, I have done this before, not often in my practice, but like if I'm at seminars and stuff, I might do that for people, but I've never really done it as a preliminary to, it's not a bad idea, actually, I might actually try it now, see, always learn something when you see. No, really, because you have those people who are really tense and really hyper and do this.
especially if they're new to chiropractic in general.
That's an interesting one, because when they're new to chiropractic in general, I tend to stay away from cranium until I educate them a little bit, because then they get really weirded out. Or they'll tell their doctor, the guy's still putting his fingers all over my head. But and that's just my experience of where I am. I tend to wait till I get a little education before I start to play with their head, so to speak, unless they're correct. But that's actually not a bad idea. Usually what I do, which is different, if I have a patient who's really tense, my way of calming down is I lay them down prone and do the sacral occipital respiratory motion, and like autistic kids, kids, even patients with hyperactive, I'll just put one hand on the sacral, one hand on the occiput, and that's my way of doing it, but this is actually a good way, because that balances the whole parasympathetic. But, yeah, I'll experiment, I'm up for it.
I have another question. The epileptic procedure,
Yeah.
you do it during the seizure,
I've never done it during a seizure.
couldn't you, if you're by yourself and you have this person in seizure, is it something?
I could try, I've never had to do it during seizure, I've never done it during seizure, so I don't know the answer to that. I mean, it depends on the type of seizure, if it's a grand, not like tonic-clonic, full-blown, I don't know,
Right, yeah,
it's kinda like doing it while you're flying out or jumping out of an airplane.
the smaller one.
But the smaller ones, yeah, you might be able to do that during, like, the petite malo, when they start to, the petite, when they drift off and they just not there. I've never had that experience in all these years, but, yeah, I don't think there'd be a problem with it. I don't see any contraindication for that. Because when they get the seizure, they're already setting up the focal spot. The worst that can happen is you bring CSF, you'll shorten the time frame of it. Alright? Alright, let's do these, because you've done most of these holes, so I don't think I need to show them, so